What makes this addictive, kind of thrill-seeking, this immediate gratification pathway so pleasurable? So some drugs release double the amount of dopamine and other neurochemicals than natural rewards. So imagine that. Some drugs make us feel twice as good chemically as anything that our intrinsic reward system can. Twice as much bliss as love or runner's high or even orgasm. Now think about the drugs that can release 10 times the amount of dopamine that natural rewards do. And as somebody in long-term recovery, it really pains me to say this, but we just weren't meant to feel that good. I can't tell you how many people I've sponsored who've said, am I ever going to feel like that again? No, we were not meant to feel that good. Bottom line is our brain wasn't designed to tolerate these constant high levels of stimulation. If excitement goes up and remains that high, the brain will adjust, right? It'll adjust by producing less dopamine, by reducing the receptors that can receive and transmit signals. But the individual who develops an addiction may have had a brain that was primed for this long before drug use. Does it get better? It gets better. But it does not get better without support, education, often treatment, often medications, and always time. It takes time. If you can wrap treatment around somebody in some level, and treatment and support, for a full year, you have the highest likelihood that that person can go on to have a lifetime of recovery. A couple of quick myths I want to do. One is that there's a lot of folks who think that, if they're not ready, it's not going to work. The studies have shown, there's major studies out on this, people are coerced into treatment, whether it's by the criminal justice system, by their license, or by what we call the mommy mandate, or criminal justice mandate, they do just as well or better than people who are not coerced into treatment. Now that sounds counterintuitive, but that's our job. Get them in. They obviously can't leave treatment not wanting to be in recovery, but that's the job of treatment. What happens when you wait for somebody to hit bottom is they could die. So it's never, you should always try and help people. You should always take care of yourself, but help people get into treatment and get the services they need.